Hi, everyone. Thanks so much for joining us today. I know we'll have some folks filtering in. I'm just going to give us a quick 5 minutes to get started. Welcome to friends, colleagues, partners, press, legislative aides, and all of you who may be joining us today for our biannual stakeholder convening for the Reaching Home campaign. For those of you who don't know me, my name's Kylie Goslin. I'm the Executive Director of the Partnership for Strong Communities. And the partnership is a nonprofit policy and advocacy group dedicated to ending homelessness and expanding housing opportunity here in the state of Connecticut. And for those of you not familiar with our two collective impact campaigns that we manage, we're here today to talk about Reaching Home. That's our collective impact campaign around homelessness that has been in place since about 2004. And through that campaign, we bring together over 100 partners that join through our various committees and work groups, as well as folks outside of our campaign who participate in an effort to bring policymakers, nonprofits, providers, and others to the table to identify solutions, work around changes that need to happen in our system, resources that we need to identify, and ultimately also create one joint legislative agenda that we all work on together, which we'll talk about a little bit later today. But at least once a year, we want to get everyone together, all those partners, as well as anyone in the public that wants to come together to hear a little bit about what's happening with the campaign, what's happening with homelessness in the state of Connecticut, especially this year, and where we're headed over the coming months. I want to thank all our key partners that make Reaching Home continue to be the strong impact campaign that it is, particularly CCH, CSH, Supportive Housing Works, all our coordinated access networks, many of our provider friends that I know are here today, Center for Children's Advocacy as well, and all our state agencies, Department of Housing, DEMIS, CHAFA, and the like. So many of you continue to step up to the plate to help us troubleshoot and work through issues. And as a result, we've had some pretty solid continued success in driving down the numbers of folks experiencing homelessness here in the state. And we'll hear a little bit more today about that data, about where we are and again, where we're headed. I want to also just note this has been a really challenging year, not for Reaching Home necessarily, although it's presented new challenges for our work, but for so many of our provider partners, for our coordinated access networks, for our state agencies. We've had an influx of federal dollars, which has been wonderful, but we've had to really pivot our work and turn on a dime to focus on protecting the most vulnerable folks that fall within our system, prevent new folks from entering that system during this challenging year and during these crisis times. And we'll hear a little bit more today about how that happened, but I wanted to take a special moment to just say thank you to so many of you who are joining us today for your work over the past year. In case you haven't been thanked, thank you. It was a tremendous effort, and to say that we were able to succeed in housing many more people than we probably ever thought possible and keeping people safe is an understatement. It was a testament to the success of the partnerships that are exhibited through the folks here in this room today. And one of the key partners in that effort, and probably one of the key teams in all this effort, is our friends at the Department of Housing. Kara, Steve, Katie, Lee, the commissioner, who I'll introduce here in a moment, have been really instrumental in making sure that we met the challenge this year in really taking, again, a massive amount of new federal resources and figuring out how to deploy them quickly, how to organize ourselves, how to keep people safe, how to change the way we think about shelters, how to change the way we think about prevention and diversion. So much good work has been happening, and it wouldn't be possible without our friends at DOH who've been there really every step of the way with us this year. And of course, it wouldn't be possible without our commissioner, Salem Mascara-Bruno. I'm so glad she's joining us here today to help kick off our events. So thank you, Commissioner, for joining us. With that, I will turn this over to you for some more remarks. Commissioner, you're on mute.
Okay, I have to do it again. Thank you, everyone. Thank you, Kylie, for inviting me to the meeting. And I think my computer now is working. as I said, the Reaching Home campaign has played and continues playing an important role in the battle to end homelessness in Connecticut. I cannot thank you enough for all your work. We knew before the pandemic that housing, more specifically housing that is affordable and housing stability, were crucially important to households' well-being and vitality. That focus on housing has only sharpened during the pandemic. My agency sprang into action since day one, providing any assistance or resources that we could. Here are some big picture items that we have either established or assisted with. The Department of Housing established the Temporary Rental Housing Assistance Program, TRAP, to assist those households who have demonstrated financial hardship due to the pandemic. So through the program, we provided approximately $25 million in financial assistance, which was paid to landlords on behalf of 6,700 renters households. Connecticut Housing Finance Authority established the Temporary Mortgage Assistance Program, TMAP, as another financial tool to assist homeowners affected by the pandemic. With the most recent stimulus package, we anticipate receiving about $230 million in rental and utility assistance. That money comes with new eligibility and reporting requirements. We are in the final stages of evaluating the most efficient way to deploy those resources. In terms of housing options for our most vulnerable shelter population, and with your hard work, we took the step of immediately decompressing the shelters by providing hotel rooms. We have provided about $35 million to the Coordinated Access Network to cover expenses from staff, hazard pay, rental assistance, cold weather conditions, diversion, etc. With these resources, the grants have placed many individuals and families into permanent housing, and I cannot thank you enough for all your work. The federal government, on the moratoriums, the federal government issued an eviction moratorium on federally backed mortgages through March 31st. Governor Lamont extended the state's eviction moratorium through the duration of the public emergency, which is set to expire on April 19th. In addition to those efforts, DOH has established the Homeless Prevention Program, specifically designed for households that are either facing eviction or currently within the eviction process. We have partnered with the state judicial branch and other legal services to coordinate referrals to the program by the 211. The core work of the department doesn't stop because there is a global health crisis. DOH partnered with the Regional Plan Association to develop an affordable housing plan and process guide with a toolkit. This guide was created to be used by those smaller municipalities that have limited resources for planning, in addition to the resources that we provide, over $500,000, so that they can really tackle their affordable housing plans. On the construction side, during the calendar year of 2020, we were able to complete 24 projects, which amounted to 804 units constructed or rehabilitated. These projects represented $36 million in state resources and $252 million in total investment. For our current activity, we have 58 projects under construction or rehabilitation, amounting to a little over 1,800 units. This represents $119 million in state funding and $305 million in total investment. Legislatively, we have done quite well within the governor's recommended biennium budget. We have over $80 million in both fiscal year 22 and fiscal year 23 for our housing homeless service line item to continue our individual and family support program. Recently, Governor Lamont also recommended that the department receive 150 additional housing vouchers to move all the families that are in shelters. My goal, your goal, is to get this done within 3 months. I see Steve shaking his head. No? That's pretty exciting.
No, my wife was showing me something that I was shaking my head at, not your comments.
Yes, so we have, as I said, we have 150 new vouchers to move all our families that are in the shelters. As I said earlier, the pandemic has sharpened the focus on the need for more housing. And this recommendation, oh, I forgot to mention, on capital. We have new bond authorization of at least $155 million in fiscal year 22 and $150 million fiscal year 23. So as I said earlier, the pandemic has sharpened the focus of need for more housing, and this recommendation speaks to the administration commitment to affordable housing. Finally, my office is monitoring all housing and housing-related bills that are in play in the legislature as we speak. We have been in communication with the Housing Committee co-chairs and other legislators, agencies, staff to express our support, concerns, or just advice in general as the legislative process progresses. I thank you all for your time, work, and effort. I look forward to working together to eliminate homelessness in Connecticut. And as always, I just keep saying, I do have a little faith that we're gonna get there. Thank you.
Follow up for the, thank you, Chelsea. And I will follow up on some of the messages that I have been receiving thus far. So I realized that I did not introduce myself before. So my name is Carleen Chamels. I am the Collective Impact and Equity Manager here at the Partnership for Strong Communities. And I wanted to really note that if you guys have any questions or comments, please use the chat and we will do our best to get to them before the end of our time. So I want to spend a few minutes providing you all with a brief overview of the Reaching Home campaign and the campaign structure. So the Reaching Home campaign was launched in 2004 to address chronic homelessness. And in 2011, the federal government, through the U.S. Interagency Council on Homelessness, created Opening Doors, a national framework for preventing and ending homelessness. At that time, Reaching Home 2.0 was launched and organized itself based on the federal Opening Doors plan. And in 2019, we underwent a restructuring of the campaign. Chelsea, if you could go to my first slide, please. So we are organized through a collective impact model. This model came out of Stanford about 10 years ago. And what it does, it recognizes when you're trying to solve a major social problem such as homelessness, there are multiple agencies involved, and each of them is looking at the issues from their own perspective, their own vision and work. And if you don't have an agency that's working, that's organizing that work, it makes it very difficult to get it done. So there are 5 elements of collective impact. And one of them, like I said, is having a backbone organization, and the Partnership for Strong Communities serves as the backbone to the Reaching Home campaign. And in that role, we help to provide policy, research support, logistic planning, and organizations for all of the working groups, as well as serves as an advocacy leader in the space. Other elements include having a unified agenda, shared measures, which you'll be hearing about shortly, as well as continuous communication and mutually reinforcing activities. Next slide, please. So there are like Kylie mentioned earlier, there's over 200 participants across 120 organizations that are engaged in this work with us monthly, if not more, since the last 17 years. And it is because of that commitment and that collaboration we are seeing some of the successes in Connecticut. Next slide. In 2016, Connecticut was certified as one of the first 2 states that had ended veteran homelessness. And when I say this, it doesn't mean that a veteran will never experience a situation that leads to homelessness, but that we have a system in place to quickly identify and house those who do. We've been able to preserve and expand critical homelessness resources during the longest and greatest fiscal crisis, as well as position ourselves to receive the Youth Homelessness Demonstration Program to support our young people who are experiencing homelessness. Can I go to the next slide? I also wanted to highlight a few things from 2020. Last year was challenging for all of us. It really truly elevated the need for housing and highlighted that housing is healthcare. Our homelessness system has done an incredible job to help ensure that our most vulnerable populations are safe. And through the campaign, we launched the 1,000 Homes effort to rapidly move those experiencing homelessness to housing. And in a few minutes, Kelly Fitzgerald will provide us with an overview of that work. Also, we began implementing a housing service screener within Court Support Services Division, which will be highlighted in an I-form on March 30th. The registration will be going out next week. Next slide, please. As a campaign, our goal is to ensure homelessness in Connecticut is rare, brief, and one time by 2023. In terms of our structure, which is on the side, there's a statewide coordinating committee, which meets monthly to coordinate the campaign and provide guidance to the work groups. The campaign has 5 work groups in addition to the coordinating committee, and the work groups help to drive creative and collaborative solutions to prevent and end homelessness. The prevention work group focuses on the where component, creating strategies to prevent people from entering the homelessness system. The CAN homelessness delivery system work group is working to put system in place to ensure that episodes of homelessness is brief. The sustainability work group is working to ensure that once someone exits the homelessness system, they do not return. And then we have the resources work group, which role is to be responsive to the needs of the resources needs of the other work group. And finally, the data and accountability work group aims to provide strategic leadership on the usage of data and to use data to inform decisions on providing equitable access to resources and housing stability across all Connecticut populations. All of the work groups meet on a monthly basis, and the work group can create time-limited task groups to help address specific issues. If you are interested in attending any of the work group meetings, please feel free to reach out to me or a member of the team, and we'll be happy to get you connected. And as a follow-up to this event, we'll be sending out a campaign update on all of the progress of all of the work group, as well as the date and times that the work group meets. So now I am going to pass it off to my colleague, Chelsea Ross, the Interim Deputy Director at the Partnership for Strong Communities, and Bo Anderson, the statewide CAN Data Analyst Manager at the Department of Housing, to provide us with an overview of the data. Thank you.
Thanks, Carlene. Good morning, folks, and thank you, Andrea. Carlene shared the campaign's overarching goal of making homelessness rare, brief, and one time by 2023. I'm going to talk about how the campaign is measuring our progress and note just how far we've come before I turn it over to Bo, who's the real numbers person, to share some current information about the state of homelessness in Connecticut. So having shared language across all of our partners is critical so that we are all pushing toward the same goals and can have shared understanding of how close or how far off the data tells us that we are. With the leadership of the Data and Accountability Work Group that Carlene mentioned, the campaign is currently in the process of setting incremental goals, defining data sources, and determining metrics for measuring progress toward making homelessness rare, brief, and one time. And that first step is to operationally defining what we mean by these words. So homelessness is rare when there are few families and individuals like Andrea experiencing homelessness in the first place at any given time, and that number is decreasing over time. Homelessness is brief when the length of a person or family's episode of homelessness is fewer than 30 days. And it's considered one time when folks exiting homelessness to permanent housing destinations don't return to homelessness within 2 years of their exit. I want to note that shared measurement is often one of the most challenging aspects of collective impact. This practice of coming to agreement on common measures with competing priorities among diverse stakeholders can be really hard. But despite that, over time as a campaign, we've used data to drive and sustain our momentum, helping organizations and regions and coordinated access networks see how they're doing locally, as well as how they contribute to statewide progress. And our partners have increasingly prioritized the collection of data and are now regularly using it to guide collaborative problem solving and strategies and make decisions around resource advocacy and allocations. And it supports our partners in developing our policy priorities that Kylie will share with you in just a bit, illuminating those gaps and barriers, as well as highlighting successes that we can bring to scale, and being able to point to the hard evidence behind our asks. Running my own slides here. There we go. All right. So what progress have we made? Well, in the last 8 years, the number of people in the homeless system, Carleen mentioned, has decreased by 57%. In federal fiscal year 2012, there were over 14,000 people enrolled in emergency shelter and transitional housing. And in 2020, that number was just over 6,000. Of note is that this doesn't fully reflect the pandemic response efforts completely. You'll hear in a few minutes how, despite the COVID-19 crisis, the homeless response system kicked into overdrive to continue this downward trend, moving as many people into permanent housing as possible and keeping people off the streets and safe from the virus. Before that, I'll turn it over to Bo to give you a snapshot of some of the key data points regarding the state of homelessness in Connecticut right now. Bo?
That's great. Hi, thanks, Chelsea. Hi, everyone. My name is Bo Anderson, statewide CAN manager for data analysis at the Connecticut Department of Housing, also a co-chair of the Reaching Home Data and Accountability work group. I believe my contact info is out there. If you all need to reach me with additional questions after, please do follow up. What I'm going to present are just a few high-level statewide indicators, starting here with probably our most famous homelessness indicator in the state of Connecticut and nationally. There's the statewide point-in-time count. For those of you who are not familiar with that, the point-in-time count is conducted on a single night in January. And we just conducted the 2021 count last month. So the most recent completed, sort of fully reported count is from last year, 2020. And as you can see, the trend from 2016 through each year down to 2020, there is a downward trajectory there. Overall, a reduction of about 25%. In the total number of folks who were counted on that one night in January, and the number of people who were unsheltered, which is represented by the dark blue portion of the column. That was cut almost in half since 2016 compared to 2020. And can you go to the next slide, please? I realize now I probably should have put these in a slightly different order, because this one is closely related to our goal to make homelessness brief. We're still working in the Data Accountability Work Group on some specific measures that will correspond to our goal of rare, brief, and one time. And this one is about the length of time that people are experiencing homelessness, specifically emergency shelter and stays in transitional housing projects there. As you can see, the columns represent the counts, which have been on the steady downward slope since 2016. However, that red line across, that's the average number of bed nights, which is just a count of how many nights folks spent staying in either transitional housing or emergency shelter. And you can see that that went up slightly in 2020. And I also want to point out that that sharp drop for 2020, a lot of that could also be attributed to just the different ways we responded to the needs of the pandemic as it came on early in the year last year, and we moved people into hotels and other non-congregate settings that are sort of counted differently and not always wrapped up in this HUD system performance measure. Chelsea, can you go to the next slide, please? Percent first-time homeless. This is the measure that is probably most closely correspondent to our goal to make homelessness rare. You know, we want an ever shrinking number of people to experience homelessness for the first time. So as you can see, in 2016, it was about 62%, which is almost, you know, 2/3 of the folks who are entering our shelter, transitional housing, and permanent housing projects for homeless people had been seen in our system before, were not new to us when we enrolled them in 2016. And you flash forward to 2020, and we're down closer to 50%, which is 17% fewer than it was about 4 or 5 years ago prior to that. So you can see still a steady downward trend. And go ahead and go to the next slide, Chelsea. Thank you. And this trend is one that's going up, and it's one that we want to go up. And this is the percentage of housed exits from emergency shelter transitional housing and rapid rehousing. That's what the ESTH and RRH mean at the top there. In 2016, 57% of all the exits from those projects were to a permanent housing destination. And in calendar year 2020 statewide, 71% of those exits were to a permanent housing destination. And this measure, I think, is closely related to our one-time goal there, because when people are in permanent housing, there are so many benefits associated with that, and it's less likely for people to end up coming back to our system than if they go to a temporary housing destination after they leave projects and service that we provide. And you can go to the next slide, please. So that was just a very high level, I talked probably faster than I maybe should have, overview of some of the high statewide data projects that we've got. But ctcandata.org is a website that many of you are probably familiar with. We have project dashboards. I post weekly status reports up there in PDF format, and we have some indicators that are updated on a daily basis on weekdays. Probably more data than anyone ever would need or want to know. But you can check it out there at ctcandata.org. There's also links to contact me by email, and I'll be here, I believe, at the end if there are questions as well. So thank you so much, Chelsea and PSC.
Thank you, Bo. We did have a quick question in the chat, like if this data is accessible right now.
Yes. All that data is on the CTCAN data website, and the data that's in the slides is available, I guess, when the slides are shared afterwards.
Yes. So yes, as a follow-up, we'll be sending out the slides to today's event. If there are no other questions for Bo, we'll move on to the next section of our agenda. So now I would like to introduce Kelly Fitzgerald, the CAN director for the United Way of Greater New Haven, as well as Wobia Williams from the Columbus House, who will be providing us with an overview of our homelessness response during this pandemic. Kelly?
Great, thank you, Carlene. And I do want to pause and take a moment really just to thank Andrea for sharing her story and her experience with us. It's those experiences that are shared with us that really drives the coordinated access networks and our just constant push towards continuous improvement and making sure that the system and services that agencies provide are really meeting the needs of everybody. So again, I just want to thank Andrea, and yeah, so thank you for that. I'm not going to spend too much time talking about the structure of the coordinated access networks. I'm happy to follow up with anybody afterwards. Really just want to talk about kind of how the coordinated access networks had to pivot and reimagine the work that we were doing when COVID-19 hit. And I'm also going to shorten my presentation slightly because I want to make sure that we hear from Robey and really his experiences on the front line working with clients during this very challenging time. So when COVID-19 hit, the CAN system had to completely rethink how we were going to deliver services, specifically on the front end, in order to keep clients and staff safe. That did mean a switch to mostly phone appointments for that initial CAN appointment. And what we did see on a positive note was a 67% show rate for those appointments, which is much higher than the average 50% that we saw when they were in person. So again, our goal to make services safe, but make sure we were still reaching the people who were in need, feel confident that we were able to do that. In addition to that, we had to immediately think about shelter decompression. For anyone who was in a congregate setting, we knew that wasn't a safe option for them or staff. And so what were we going to do differently? And so with the support of the shelters, our statewide partners, and our local hotels, we were able to quickly move over 850 people out of congregate setting shelters and into hotel when everything first happened in April, so that we could keep people safe. And we're feeling really confident when we look at the numbers of positivity and we look at deaths associated, we are seeing really successful trends within the homeless response system. And we do correlate that to our ability to move people into safer locations during that time. In addition, shelters and programs needed to figure out, like, how are we interacting with clients and making sure that we're safe? So do we have the adequate PPE? Do we have the protocols? And how do agencies not have to work by themselves in order to figure these things out? So that, again, reinforces the benefit of the CANs, of the Reaching Home Committee, because that was where we were able to come together and work to address these needs together. Isolation plans, testing, vaccine. I mean, this is all, it feels like right when we figure out one thing, then it's on to the next. And that's great, right? We're seeing really good success with the partnerships, but testing and vaccines for clients and staff was absolutely critical. Across the state, we're seeing really important partnerships with our local health centers, and really just want to give a shout out to all of those, including Cornell Scott, who has come to the table and partnered with the CAN system in a way we could have never imagined. Next slide. So once we were able to move everybody into the shelters, out of the shelters and into hotels and keep people safe, then we immediately went to, how are we going to house people? Right? The hotels and shelters, those are always short-term solutions. Our end goal is always to have permanent housing for individuals and families. And so that's when the state came together and really embarked on the 1,000 homes. That was really able to get off the ground because of the $8 million that Department of Housing received, and going out to the regions and everybody, again, coming together. There was never a moment when people were working from home trying to figure out what to do. Everybody was still working so hard, being in person as much as possible. And we knew that's what it was going to take to house as many people as we could. So one thing, another big success that we want to share is that since June 1st, we've housed over 2,400 households because of the 1,000 Homes initiative and the new resources that have come in. And you'll see in this chart, which again is all located on ctcandata.org. So as Bo mentioned, please go check that out because there's a lot of interesting information, and there is a tab specific to 1,000 homes, so you can get right to this. But you'll see within this that this wasn't just one way of housing people. We still had to be creative to figure out, who can self-resolve, who can quickly stabilize with a small amount of resources, and who really needs more long-term support. And so that's what all of the shelters and housing providers did over the last year. And we're seeing the success in the numbers because of that. Next slide. So looking ahead, as always, the work is never over. Until we actually know that homelessness is rare, brief, and non-recurring. So what are a few of the things that we really are going to focus on within the CANs? One of those is really needing to increase our supports, both staff and financial assistance, to maintain and increase our diversion efforts. With all of these efforts to move people out, our biggest goal is not to then have more people coming into our homelessness system. We're seeing really positive results in our diversion efforts, and we just want to be able to maintain and grow those across all populations. Next would be long-term planning for shelter services. We do know at some point federal resources are going to come to an end related to hoteling. And what does that look like? How do we ensure that staff and clients are safe? And how do we also make sure we have the capacity that we need? So working with Department of Housing and all of the shelters to figure that out so that we are ready when it's time to go back. And lastly, long-term planning around how are we supporting our housing programs and staff to be able to serve all populations. We know that the resources in the system are are inadequate? And how are we going to make sure that we're infusing enough resources into the system to pay staff what they need to be paid, to have enough to serve everybody, and just really working together to understand what that need is and then advocate for it is going to be critical in the coming months and years. So that's it for me. As I said, I can answer any questions at the end, or I'm happy to talk offline. But really, I just want to now introduce Robay Williams, who works at Columbus House. He is one of the most amazing outreach workers I've ever met. He is always willing to, he never stopped working on the front lines. He's been jumping into many different roles, as most staff have done over this last year, to meet the needs of the clients and the work that we're doing. So yeah, I'll turn it over to Robay now.
Thank you, Kelly. Hi, everyone. My name is Robay Williams. Like Kelly mentioned, I'm an outreach and engagement caseworker for the Columbus House. Yeah, it's been tough. I just wanted to hit on a couple topics about, for our frontline work that we have been doing. I just want to exclude the first 90 days of the pandemic because it was just a lot of confusion, a little bit of chaos to figure out what we was going to do, how we was going to stay safe, how we was going to keep the clients safe, and things of that nature. And I think that was just all around the board with all of our organizations that are dealing with the pandemic. But after that, and once everything started opening up a little bit more, it just was a blessing for us to have resources to help our clients as quickly as we helped them, because before it was kind of a waiting game, have to be patient to get the clients' documentation ready that they needed. But I think a little bit of that lifted up, and a little bit more humanitarianism stepped in, excuse my words. But I think that opened up through the pandemic, instead of we need certain documents, but it was more for the clients to get housed. And I think that was a blessing, because as frontline workers, we were able to advocate a little bit easier for who needs to be housed through age or illness or anything like that. And the next thing was, I want to say, the next thing that really surprised me through this was how all the organizations really came together with, especially like the CAN, and all the organizations just fell and came together and just wanted to make everything achievable for the clients. And if they had to move stuff to the side and things of that nature to really focus on being client-based, it really happened. And we could see it and we feel it through the work that we do. It's just, the whole year's been tough. But since everything opened up a lot more, I'm hearing numbers that I haven't heard about the housing on 2,500 or 2,400, and that's great to hear. I was very impressed with that, because I know we worked hard to get a lot of our clients on a Columbus House in housing situations where they could succeed and stay housed through the pandemic. And I know we tried our best to do that, working with the CAN and other organizations. And also, I think a couple of the barriers are that we're experiencing now is still not a lot of stuff open. Clients is, they want to have somewhere safe to go. And that is, through the pandemic, it's limiting us to tell them where to go. I know a couple programs are opening up. I think Liberty Community Services is starting an initiative called Operation Clean, where it's more so like another day program where they could take showers and wash clothes, because that was the main issue. Socks, showers, clean clothes, the whole pandemic. And I just feel that everybody that was involved with anything that had to do with this homelessness initiative, that y'all are truly a blessing to the clients. And I know we have a lot more work to do. I'm paying attention. I know my team's paying attention, so we can hurry up and tap into these resources as they come so we can help more people. And that's all I want to say. So thank you for your time.
Thank you so much, Kelly and Robey, for providing us with that overview and where we are at. I'm very grateful that the both of you were able to join us this morning to provide us with some insights. And now I'm going to pass it back to Kylie Goslan to provide us with an overview of our legislative agenda and the resources that we are advocating for to ensure that our clients have a safe place to go to, and share some ways that you all on the call might be able to assist us with. So Kylie?
Yeah, thank you everybody for joining us today. Thank you so much, Rebecca, for that awesome overview. Kelly, Andrea, all of you who've taken some time to tune in today and sort of center ourselves in what's been happening. And that's what this meeting is really for every year, to really look at where we've been, where we need to go, assess what's working and whatnot, and talk about that. So as I mentioned at the top of the meeting, a big part of what we do at Reaching Home is trying to coalesce around a singular legislative agenda. There's a lot of reasons for that, but ultimately, with collective impact, when we have a goal that all of our organizations and all of our providers and everyone here is focused on, then we can come together and decide what are the things that we need to ask for at the state legislature on an annual basis to keep the success going and to make further progress. You saw from Bo, thanks Bo for that great data presentation. You saw from Bo that we have some trend lines going down, and you heard what an influx of new resources has looked like this year, how many more people we've been able to house. So we try to take all that learning at Reaching Home and through our work groups, feed up ideas for different policy priorities, financial asks, bills that we may need to come up with to try to target key problems and identify new resources. So that's what I'm going to walk through with you quickly. This is our 2021 legislative agenda. For those of you who are part of Reaching Home, you've also all been getting some action alerts as we enter the session where there are hearings coming up. We send out templates and flag hearings where specific items on the agenda will come up. So we encourage you all to testify, to submit written testimony, or to Zoom on to one of these Zoom hearings now, get your number and talk about why you support some of these specific items. And similarly, we're always here to help. It's part of our job as a backbone organization to assist you all in reaching out to your legislators. And in this session where we're not doing as much in person, calling your legislator or setting up a Zoom meeting, either a legislator that represents you personally where you live or your organization can be really helpful. Talk about what happened this year, talk about what you saw on the ground like Rebecca just did, and share what's needed to keep moving forward. So with that, we'll walk through the agendas and we'll talk through. The campaign really felt it was important to put together a very full agenda this year. Typically, we've only had 3 or 4 items, but everyone really felt it was important to show the full need and to make that known. But the first item on our agenda, as it is often every year, is to protect the existing resources that we have. And that's the DOH Housing and Homeless Services line at 85.5, the homeless youth line item, supporting that at 2.3 and 2.9, noting that's a slight increase is proposed under the governor's budget, and I'll talk about why that is in a little bit. And the DEMIS Housing Supports and Services line at 23.4 million, and I'll talk about some requested increases in DEMIS funding as well. Just, I would note first on this, on the 85.5 million, you will see in the governor's budget this year that there was a proposed reduction in that. That's some lapse funding that turns up every year, and we're asking legislators, as we did at the DOH appropriations hearing, to consider retaining that lapse funding and putting it towards RAPs. Those are state housing vouchers, our rental assistance program, and other housing and homelessness services. And so we'll happy to provide you with more information on that. Next slide, please. And the second item is a ask that has been one that the campaign has been pushing for the last 3 years. Our coordinated access networks, which are organized under our CAN Homeless Delivery System Work Group, which you heard Kelly talk about, really need permanent, stable funding. It's been funded. The CANs are funded primarily through CIA funds. That's flexible funds that come to the Department of Housing through effectively real estate transactions. It's a flexible fund that funds a variety of things around the state. And one of the things it funds is affordable housing programs through the Department of Housing. And so that's one of the ways that CANs have been funded. They also fund themselves, as you all know, through philanthropic resources and other sort of service contracts. But without a permanent, stable funding source, CANs are left many times to try to maintain funding through gaps with less predictability in terms of maintaining staffing, and that can drive up intake wait times and other things. So we've been talking with legislators about this item again this year. I'd encourage you to talk to them about it. We are lucky to have a commissioner that's continued to use those CIA funds to support CANs, but we feel it's important that CANs are recognized as a critical safety net system in the state and have that dedicated line item so they know year after year that they're going to have the funding they need to pay their staff and keep going. Next, please. Next are the capital investments for affordable and supportive housing. So this is, as many of you know, we have a sister campaign, Home Connecticut, that focuses on the affordable housing side. They have their own agenda, and this item is reflected in both the Reaching Home and the Home Connecticut agendas. So this is for the Housing Flex Fund and the State Housing Trust Fund. This is to both rehabilitate existing units of affordable and supportive housing and preserve units we have in our system that need rehabilitation or re-upping of their affordability cycle, as well as creating new units of affordable housing. So this year, the governor proposed $305 million for the biennium. That's for both of those different funds. And so we are supporting that. And you'll see it again in both agendas. Next slide, please. All right, and so number 4 is some funding for the YHDP program. So many of you are familiar with the fact that Connecticut has done some great work in the space of youth homelessness, but we have a ways to go with this. That being said, the state, through its CT boss and our ODFC, our 2 continuum of cares in the state, have been awarded $6.5 million in federal dollars towards ending youth homelessness in the state, which was a huge gain for the state of Connecticut and particularly for this population. But in order to make sure we can draw down on those funds, we've got to match them, right? And that's a challenge, identifying that match funding. So we've worked with the Department of Housing to identify some resources, and we've asked the state to set aside additional funding you see here in this item. And that has been proposed to be added to the youth line items for the coming biennium so that that match funding is there as requested. However, we want to ensure that that funding isn't just coming out of the Housing and Homelessness Services line item at DOH and moving to the youth line item, that it's a real investment here. Next slide, please. Number 5 is a bill, and this is a bill that was put forth last year by the campaign. So again, the way our legislative agenda is set, we have those 5 work groups that you heard Carleen speak about at the top of the meeting. And those work groups get together and talk annually, usually starting in the late summer, about what might be appropriate to bring to the legislative agenda for the coordinating committee for discussion to go on our agenda that following year. And this was an item that has come up through our Youth and Young Adult Task Force last year. It was an item that was specifically identified from some youth with lived experience who are part of our campaign, noting that getting access to things like birth certificates and state issued IDs is a hurdle for many youth experiencing homelessness. These are documents they need to access benefit programs, sometimes education, employment, and there's fees associated with getting these documents. And so the Reaching Home campaign has been working closely with the Center for Children's Advocacy on putting together this bill. It had some great traction last year in the legislative session before the session shut down. We've been working closely with DMV and the Department of Public Health on this, and we're hopeful that we can get it passed this year. So if you're a youth provider out there, this is something that's worth picking up the phone and calling your legislator about to try to get it through this year. We're working hard on this one, and we hope that we can do that. Again, would allow a fee waiver for those particular identity documents that youth need so that they can either access those free themselves or work with a case manager to do that. Next, please. Number 6 is targeted investments for supportive housing and services. The campaign, along with other partners, particularly the Corporation for Supportive Housing, have been taking a look at our data, doing some analysis on that, and identifying that we really need some more supportive housing in the state. For those of you who've been around this world for a while, you know that the state many years ago did a great job of pushing out funding for new supportive housing units, and that's part of the reason we've seen that downward trend that Bo noted. Supportive housing is a great cost-effective resource for ending chronic homelessness, specifically for folks with high needs who need those on-site services. And so we've asked for an additional funding for those 200 scattered site units. And I would note too that the Affordable Housing Flex Fund ask that we had earlier could also be used to develop affordable housing. And then also some additional funding for services. We note that services funding is a challenge, especially for where folks are in scattered site environments, perhaps in a low-income housing tax credit unit, and need services provided in those locations where it's not a one building situation. So I will move to the next slide. Thank you. Sorry, I got pop-up windows here. Following on the heels of that, in addition to, this is all part of our number 6 ask here, there is been a repeat ask for additional outreach funding through the campaign. These are services in terms of folks going out, identifying folks that are sleeping outside or otherwise need outreach. This is a small amount of money, $375,000, but it's enough to provide some part-time positions and some additional resources through our CANs and providers to provide more outreach. And that funding is through DEMIS, so we're asking for that again this year. Hopeful that we will get that, but if you are particularly, again, a provider or somebody else with a CAN who knows about this shortage and is interested, this is a great reason to reach out to a legislator as well. And then you'll see a final ask for folks exiting CVH and psychiatric institutions. This is for wraparound services as well as some diversion to ensure that folks exiting our other institutions either don't end up in our system at all or are able to get the wraparound services they need so that we aren't seeing folks cycling in and out of facilities. Next, please. And then finally, and this is perhaps one of the most important asks on our list this year, our sustainability work group, which is focused on sustaining our successes in this space, but also in really ensuring that folks who exit our system stay housed permanently, have what they need to do that, but also that our organizations, our providers are able to help sustain those folks. Identified again that as you heard, our organizations have been stretched thin, particularly this year, to provide the resources they need. And many of our providers who are recipients of state contracts have not seen a COLA or increase in those contracts in many, many years. And this makes it really difficult to continue to pay providers. It makes it difficult to hire staff, makes it difficult to retain staff. In some cases, folks providing clients with services are recipients of those services themselves. And so the sustainability work group got together, looked at a couple different models and decided that the best way to proceed was to add our voices to the Connecticut Nonprofit Alliance proposal to restore funding, add funding to those contracts, particularly around Medicaid reimbursements, to ensure that there's some extra funding for our providers out there. This topic we're encouraging folks to speak up about at a DEMIS appropriations hearing that will be happening next week. So we just sent out an action alert that's available on our website. Again, if you're a provider, someone working with providers, and you know that this has been a challenge for you, we'd encourage you to submit testimony, reach out to your legislators, or come to that hearing in person via Zoom to participate and lend your voice to that wider providers seeking this.
We're grateful. So I was wondering.
Oh, someone came off mute. Okay. So I will pause there. That is the conclusion of our legislative agenda. and ask if folks have questions. Also noting we have the our legislative advocacy webinar coming up next week. So that's another way in which you can access more information about this. There's more information about that on our website. If you're on our listserv or our newsletter, you can see a link to how to get information and log into that webinar. Let's see, I have a question from Margaret. Anybody else have any other questions about the, I'll jump into Margaret's questions in a minute. On the legislative agenda. Okay. Yeah, Margaret had a question about the Connecticut Nonprofit Alliance, and I'm happy to do my best to answer this, but if others want to jump in as well, that's great too. As I noted, the sustainability work group looked at several possible models, unit per pay, and a variety of different potential avenues to try to seek additional funding for providers this year. And part of the reason that we opted, or I should say the sustainability work group opted to propose the Connecticut Nonprofit Alliance, is that there's been some momentum around that ask. The Nonprofit Alliance has been seeking that increase for some time, and that our system touches a lot of providers. In addition to frontline workers, as you know, there's a lot of mental health workers and others that work within our system who would benefit from that. And so rather than carving out something specific, the campaign felt it was really important to add our voices to the Nonprofit Alliance and seek that. But I would encourage, again, all of you to lend your voice as a homeless specific provider to the conversation about this. There's going to be a lot of providers testifying, I think, and there's the Nonprofit Alliance represents a whole host of folks who would benefit from this ask. And so I'd encourage you to come to the hearing to talk to legislators about your specific programs and why it's important, the challenges that you've been facing, and to share that. So Heather responded to in the chat on that. Thanks, Heather. Any other questions? Okay. I will turn it back over to Carleen or Chelsea. Not sure who's jumping in.
I'll jump in quickly. So just want to say thank you, Kylie, for that overview, and anything that y'all can do to help support us this legislative session would be appreciated. So I wanted to share a few upcoming events and webinars that's going to be taking place over the next couple of months. Kylie already shared the information about the legislative advocacy webinar, which is going to be taking place next Thursday. I also want to let you guys know we'll be organizing, hosting an iForum around addressing homelessness through upstream prevention efforts on March 30th. So the registration will be going out early next week. And we currently have a call for nomination of the Reaching Home Award celebration. And what this is every year we put out a call to providers, system leaders, anyone who's engaged in this work to really share some of the stories and to really recognize some of the individuals, the tenants, the providers, everyone who is doing some form of work, and to recognize them. So the nominations went out to all of the work groups earlier this week, and it went out in our newsletter yesterday, and you'll be getting a couple more emails from us soon. And also wanted to let you guys know that we've to save June 16th for the Reaching Home Award celebration, where we will be honoring those individuals who have been nominated and selected for the Reaching Home Awards celebration. Think that is all. Oh, I also have one last thing. We didn't get a chance to mention it during the data presentation. The Data and Accountability Work Group is currently seeking feedback around how data on homelessness are being used and where there may be unmet needs. So they're currently conducting a survey, which should take about like 10 minutes to complete. So we will add that link to the chat right now. So would could really appreciate your taking a few minutes just to fill those out. I think that is the extent to the information that we wanted to provide. If there are no additional questions, please note that we will follow up and send the slide deck as well as all of the materials and resources that's been shared in the chat to you all as next week. Thank you.
All right. Thank you, everyone, for joining us today. Look forward to seeing you again in a future meeting. Again, please participate in our legislative advocacy this season, this session. We look forward to seeing you all at a hearing soon. But thank you for joining us all today. Thanks to all our speakers.